In this video, we're looking at chlamydia. Chlamydia is generally the term used to describe the sexually transmitted infection caused by the bacterium Chlamydia trachomatis. It is a gram-negative obligate intracellular bacterium with an incubation period of roughly 2 to 3 weeks. It typically affects the endocervical canal, or urethra in females, and the urethra in males, but it can also affect the conjunctiva, eyelids, nasopharynx, and rectum. Chlamydia has two distinct forms. Initially, the bacterium invades the cell in the form of elementary bodies which enter with a vacuole called an inclusion. These elementary bodies are then reorganized into reticulate bodies which replicate. After replication, they mature back into elementary bodies, and after 2 to 3 days, the cell ruptures, releasing new elementary bodies to infect other cells. Chlamydia pneumonia and Chlamydia psittaci are two other species that cause disease in humans, mainly respiratory tract infections. Psittaci is rare and linked to contact with birds. Overall, chlamydia is the most common bacterial sexually transmitted infection in Western countries, most often occurring between the ages of 15 and 24. However, it can also occur in elderly populations, and in younger patients, it may be a clue to underlying abuse. Prevalence is estimated to be between 2 and 5% in the United States and United Kingdom. Risk factors include a new sexual partner, multiple partners, or a history of previous STIs. Most cases are actually asymptomatic. Around 70 to 85% of females and 50% of males show no symptoms. In females, the endocervical tract is usually affected. Symptoms include postcoital or intermenstrual bleeding, dysuria, vaginal discharge that is usually mucoid and odorless, and pelvic pain. If left untreated, the infection can ascend the urogenital tract and lead to pelvic inflammatory disease, as well as Fitzhugh-Curtis syndrome, which is perihepatic inflammation. There is also an increased risk of ectopic pregnancy and infertility. During pregnancy, chlamydia can lead to neonatal conjunctivitis and pneumonia. In males, the urethra is typically affected. Symptoms include dysuria and penile discharge. If not treated, it may develop into epididymoitis, inflammation of the epididymis and testicles, or prostatitis. A notable immune-mediated complication is reactive arthritis, previously known as Reiter's syndrome, usually occurring 4 weeks post-infection. It is characterized by joint pain, often in the knee, ocular involvement such as conjunctivitis or uveitis, and urethritis, which often presents as dysuria. This can be remembered by the saying, can't see, can't pee, can't climb a tree. Another associated condition is circinative balanitis, a ring-shaped rash on the glands of the penis, often seen with reactive arthritis. Lymphogranuloma venereum is caused by the L1, L2, and L3 serotypes of Chlamydia trachomatis. It follows a 3-phase course. First, a painless ulcer, then a painful unilateral inguinal or femoral lymphadenopathy, followed by proctocolitis. An important ocular manifestation is trachoma, where Chlamydia trachomatis infects the eyelids, causing roughness, irritation, corneal injury, and potentially blindness. Diagnosis is usually made using nucleic acid amplification tests, typically from vulvovaginal swabs or urine in females, and urine samples in males. Contact tracing is essential to identify and treat asymptomatic carriers. In the UK, annual screening is recommended for those under 25, and in the US, chlamydia is included in antenatal screening because of the risk to newborns. It is also recommended to screen for other STIs like gonorrhea when chlamydia is present. Doxycycline is the first-line antibiotic, while macrolides like azithromycin are second-line options and used as the first choice in pregnancy. Sexual contact should be avoided for 7 days after treatment begins, and all sexual partners within the last 60 days should be tested.